California has some big ideas, like single-payer health care for all, even for non-citizens. The question is, can California actually pay for it? Welcome to America Uncovered. I'm Chris Chappell. California has always been a state of big ideas, from Hollywood to Silicon Valley to Silicon other things. What's that, Shelley? That's silicone, not silicon. Easy mistake to make in California. Speaking of things filled with artificial gel, California Governor Gavin Newsom. Newsom wants to spend $10 billion on zero-emission vehicles. Zero-emission vehicles, those already exist. They're called bikes. But $10 billion is a low price tag compared to the $300 billion universal health care proposal from the California State Assembly. Actually, according to the Assembly Appropriations Committee, that plan could cost between $314 billion and $391 billion annually. So really, it might be closer to $400 billion a year, which is almost as much as it costs to own a home in San Francisco. You know all those homeless tent cities you see in California? The rent for those is $1,900 a month. That's some crazy tent rent. As recently as last month, the California State Assembly was debating Assembly Bill 1400, Guaranteed Health Care for All. The only problem is, at over $300 billion, it's bigger than Governor Newsom's entire state budget proposal for next year, which is supposed to cover everything, including health care, which helps pay for those silicone other things. So yeah, that's a lot of money. And yeah, it sounds like doubling the state's expenditures would make it go bankrupt. But first, let's talk about what this proposed $300 to $400 billion would be paying for. The bill would create the California Guaranteed Health Care for All program, or CalCare, to provide comprehensive universal single-payer healthcare coverage and a healthcare cost control system. The bill would eliminate all private health insurance. It would replace it with a single government-run system. And given how good the California government is at running every other system, I'm sure it won't be a dumpster fire. That's definitely not zero emissions. CalCare would be built on a fee-for-service model, similar to Medicare. Private healthcare providers like hospitals and private doctors' practices would still be allowed, but the state would control the prices. Federal health programs like Medicare or Medicaid would be phased out. And California health programs like pet cryotherapy and dream meditation would still exist, because California gonna California. But instead of federal programs like Medicare and Medicaid, the bill proposed having existing federal health care payments go through CalCare, which would then assume responsibility for all those benefits and services. CalCare would cover all California residents, regardless of their immigration status, which is probably California's ploy to keep people from leaving the state. Hey, New Yorkers, if you don't like high taxes, come to California. We still have high taxes, but at least we have sunshine and free health care. Plus, roomy, affordable tents. But how will California pay for all that sunshine and free health care? And could it bankrupt the state? I'll tell you after the break. Welcome back. The California State Assembly is debating an ambitious universal health care plan that could cost between $300 to $400 billion a year. Supporters of the plan say that price tag is still less than what employers and individuals currently pay for private insurance in California. But one major criticism of the initial version of the bill was that there was no funding plan for it. So sponsors of the bill got to work and authored another bill called ACA 11 that spelled out how they plan to pay for it. Before I tell you their plan, let me see if you can guess. I'll give you a moment. Yeah, it's taxes. You all saw that coming. There are several different taxes in the bill. For businesses, there would be a new excise tax of 2.3% on gross income over $2 million. Keep in mind, that's a tax on gross income, not net income. So if a business has a gross income of more than $2 million, but its expenses are also over $2 million, it would still have to pay that 2.3% tax even if it's losing money. Forcing people to pay up when you know they don't have the money for it. What are you, my bank's overdraft fee? Businesses and organizations with more than 50 employees would get a payroll tax increase of 1.25%, and an additional payroll tax of 1% if any employee earns more than about $50,000 a year. Considering that the cost of living in California is so high and that salaries are usually correspondingly high, most businesses and organizations would fall into that category. But don't worry, I'm sure no business would cut workers or lower salaries to save money. I mean, who's ever heard of a business trying to be profitable? Especially when they may wind up also having to pay what's essentially a bank overdraft fee. Finally, for individuals earning more than about $150,000 a year, there would be an increased personal income tax starting at 0.5% and going up to 2.5% for those making $2.5 million or more. The nonprofit Tax Foundation estimates the new taxes would raise $160 billion annually. Wow! All it took was almost doubling the state's taxes. And that only gets California halfway to its goal, which means the state would still be facing bankruptcy. But good news, they have a plan to get the extra $140+ billion. Sell their organs to the black market? No, they're going to appeal to an even shadier organization of ne'er-do-wells, the federal government. California is hoping the federal government will continue to give California the same amount of health care funding it currently gets, and that it would agree to have Medicare and Medicaid money funneled through CalCare instead. So, higher taxes and relying on the federal government. Now, you might think a lot of people would hesitate over this wishful thinking. But sponsor of the bill, Ash Kalra, says, don't worry. He argues that the rise in taxes will be offset by businesses not having to buy health insurance for employees, and people not having to pay health insurance premiums, copays, or deductibles. He said, in addition to guaranteeing health care to all Californians, it would save families and businesses thousands in annual health care costs by cutting out the bloat, waste, and inefficiencies of our fragmented for-profit insurance system. And just think of the utopia Californians could live in if they never had to pay for health care. Wait, this is Los Angeles we're talking about here. There, that's more realistic. They're going to need to use every last bit of that health care. California isn't the first state to attempt a state-run single-payer health care system, but previous efforts have all failed. I'm sure the reason similar efforts failed in Vermont and Colorado was simply because they didn't have the courage and vision to see them through, not because they didn't have the funding, or they faced opposition from voters, the very people they claimed they wanted to help. But this time it'll be different. This is kind of like a guy saying, I know asking out the Hooters waitress didn't work out for those guys, but I can tell she's really into me. I wish I could be that blindly optimistic about anything. Now, because ACA 11 would raise taxes, it would have to revise current California tax law. In 1978, the state passed Proposition 13, which said that any change to the tax law in California had to be approved by a 2/3 majority in the Assembly before it could even be put on a ballot. But ACA 11 tried to get around this. It tried to make it so that only a simple majority would be needed to increase taxes to pay for single-payer health care, which makes it sound like the authors of the bill didn't think it had that much support, so they needed to rewrite the rules to make sure it passed, which is what the Democrats just tried to do in the U.S. Senate, which I talked about in a previous episode. But California, it's like, I know it didn't work out for them, but it'll definitely work out for me. As you might imagine, there were a lot of concerns about these bills. I'll have more on that after the break. Welcome back. Not everyone is happy about the California universal health care bills, and a lot of it comes down to taxes. A fellow at the Tax Foundation argues that the payroll tax on businesses with 50 or more employees could deter small businesses from expanding. And the payroll tax on businesses that pay employees more than $50,000 annually could create an incentive for businesses to pay their employees less. In 2019, the median household income in California was more than $75,000, which sounds like a lot when compared to many other parts of the U.S. But with California's median home price expected to pass $800,000 this year, earning less than $50,000 a year could make it pretty hard to live in the state, especially when the tent rent is too damn high. Other critics of the bill, such as the California Chamber of Commerce, argue that the new taxes would encourage even more businesses and people to leave California. And if businesses leave, that means lower tax revenue overall. And even some California Democrats, who initially voted to pass the single-payer health care bill, said they would likely reject it when it came up for a vote in the full assembly. To keep lawmakers from defecting, the Progressive Caucus of the California Democratic Party threatened to pull its endorsement from lawmakers who voted against it. Ironically, this health care bill could use some health care since it seems to be dying a slow, agonizing death. So what happened with these bills? The Guaranteed Health Care for All bill made it through the California State Assembly's Health and Appropriations Committees. So Democrats needed 41 votes to pass the bill in the full assembly, and they control 56 out of 80 seats. However, even after California's Progressive Caucus threatened to pull endorsement for Democrat lawmakers who didn't vote for it, one of the authors of the bill, Ash Kalra, chose not to put it up for a vote because he didn't think it had enough support, which means over a dozen Democrats did not support the bill. The bill needed to be voted on by January 31st or it would expire, which is exactly what happened. But if you thought that was the end of universal health care, at least for the poor in California, you'd be wrong. When Governor Gavin Newsom unveiled his $286 billion budget last month, there was funding for the expansion of medi-cal, the state's Medicaid program. The funding extended health care to all illegal immigrants in the state. Public funding for illegal immigrants in California isn't new, though. Already, Medi-cal covers illegal immigrants under 26 years old, and in the spring, it will start covering those 50 and older, which means immigrants ages 27 to 49 are all going to lie and pretend to be 26 years old, which, to be fair, is what everyone in Los Angeles already does. Newsom's proposals would open Medi-cal to the remaining illegal immigrant population of approximately 700,000 people, and he's expecting it to cost an additional $2.2 billion annually. If approved by the state legislature, it would begin in 2024. Until then, and afterwards if it fails, all those silicone other things will still need to come out of pocket. So what do you think about California's attempts at universal health care? Do you think it should be open to illegal immigrants? Let us know in the comments below. And don't forget, America Uncovered is supported mainly by viewers. So please, drop by our Patreon page and give $1 or more per episode so we can keep making great episodes. Once again, I'm Chris Chappell. Thank you for watching America Uncovered.